Good afternoon. And today we have a very special guest. He is Australian dentist who, just like me, practice dental sleep medicine and myofunctional therapy in Australia. Good afternoon or good night, Dr. Alexander McDonald.
Hi, Maria. Thank you very much for having me on your show.
So first of all, thank you very much to our audience. If you have trouble sleeping or sleep next to snoring partner, this program is going to be for you, because we both in the same area of practice. We serendipitously come to that idea what dental sleep medicine or sleep apnea or sleep and breathing disorder based on function. And we're going to talk about not about anatomical change, but also anatomical change plus function create a very good results in both of our practices. And if you're a medical professional who, just like us, so passionate about helping people sleep and breathe better, this program is going to be for you, because as a practitioners, we're going to share our challenges, successes, and failures on this interview. And let me talk about our meeting. I find it so special. I have this program or this channel for the last 3 years. And yes, I had idea in mind what I'm going to create, this community of patients and professional kind of in the same comfortable space. But I did not envision what I'm going to meet amazing people like Dr. McDonald through that program. So Dr. McDonald comment on my post, and his comment was so special, not just like hello or thank you or heart, but he really in a good way make me feel, oh, we can work together, we can change something together. So we start conversing and we schedule this program, and it's actually midnight for him, so he's really doing it for us right before meeting in London. And we're gonna I find it so special what several stars kind of get together. That's why we have stars on the screen, and we can talk about that and maybe open some eyes with our conversation. So Dr. McDonald had training in Australia, and he actually very smart. He received academic medal, and then he worked in public dental system in Victoria and Tasmania. We all want to know more about Tasmanian devil. And he served 5 years in Royal Australian Navy, and he was a senior dental officer. And after that he built the practice, dental practice, what he integrate oral wellness, because that's the beginning of overall wellness. And he's passionate about community engagement and health education. He has 2 postgraduate diploma in orthodontics and dental sleep medicine. So a lot of serendipity moments. I'm also very passionate about orthodontic and dental sleep medicine. And just like me, he's certified orofacial myologist and accredited lifestyle medicine practitioners. And I want to ask you, Alexander, how come you came to the idea what practicing orthodontics and dental sleep medicine with orofacial myology can bring a lot of health to your patients or get you successful results?
Yeah, look, thank you for the introduction, Maria. And look, it's a great question. I think historically, my training really prepared me to be, a safe clinician, but also what I kind of realized after a few years of practice was I was just treating symptoms. And so my journey, as you mentioned in my bio, it has been full of excitement, and it's a constant learning process, and we're all learning from each other. That's why we're having this chat right now. But I think, in more recent times, and we're seeing more and more of it now, that, that orthodontics, dentofacial orthopedics, dental sleep medicine, elements of orofacial pain and, function and health really go all hand in hand. And I think as a well-rounded general practitioner or a general dental practitioner, it's important. We owe it to our patients to be across, all those sort of areas, so that we can really achieve some truly excellent results and look beyond the teeth. Yes, we're dental practitioners, but there's people attached to the teeth and the gums. We've got to start thinking about the people, and we owe it to our clients, to our patients, to really optimize not just their oral health, but their general health as well. And I think dental practitioners can play a really big role in doing so.
Yeah, this is a beautiful answer, and I like that observation, what people attach to the teeth, and people use the teeth as a balance board, I would put it this way. So they express a lot of what's going on inside on that, on that board. But how, yes, I agree with you, and I'm going to talk about that on my Mewing conference presentation, how my orofacial myology opened my eyes, because a lot of dental pathology, or I would say open bite, crowding, TMJ pain, periodontal disease we're talking about, very red gums or bleeding gums in the front and normal gums in the back, I was not able to explain. And, and we use that, I love that word, and we talk about that, multifactorial disease. Multifactorial disease, for me, it's like you don't have to think. Like you can just relax. Multifactorial, it's not my area of expertise. I'm going to give you the pill, painkiller, antibiotics. I'm going to clean the gum, maybe do pulpotomy, and we close the story, or whatever, root canal, or give you the guard, but not thinking about what can be the root cause. For me, I always explain to my audience or to myself, I actually had a Russian dental degree first, and we had a very limited supplies and very limited pharmacology in general, or technology in general. So we must think about root cause, because there was nothing to treat symptoms with. But here in the United States, my life is totally different. I have pharmacy open 24 hours. So multifactorial disease can be the way to go for me. But when I noticed those, orofacial signs, that was a big revelation. Now I try to be like Sherlock Holmes and find the reason before I do prosthetic cases or root canals or anything, or perio. Tell me, how was your aha moment? How it happened for you?
Well, I completely agree, Maria, and I think we've got to understand, and our audience as well, that signs occur before symptoms. I think gone are the days where we just sit in anticipation, waiting for something to cause some symptoms. If you go to the right practitioner who has done some further study in all of these areas, we can pick up some subtle signs before they become symptoms, and that really goes back to optimal health and achieving the best kind of outcomes for our clients. But I think there's a huge role for us to play, and we owe it to ourselves to look into these other areas, and also make sure that we're comprehensively assessing everything. Especially these days, we're seeing more and more research come out about the oral systemic link, and so we can have a really meaningful impact on our patients' overall health and well-being.
I have a question for you about clear aligners in orthodontics. So I want to know how you design, I can say, sleep and breathing disorders treatment, not even necessarily sleep apnea, or sleep apnea treatment, combining ortho, sleep appliances, and myofunctional therapy. What's your design of that treatment?
Yeah, so I guess there's a few elements at play here, but you know, we're taught from an orthodontic perspective to just get the teeth straight, but we really should be looking well beyond that. Yes, dentofacial aesthetics are, important, but we also have to think about what's the breathing like and how does that influence sleep. And we know that function or dysfunction can have a really big negative impact on those sorts of things, which can affect overall quality of life. So when we design a treatment plan for an orthodontic case, that you might do with fixed appliances or removable appliances such as clear aligners, we should be thinking about the airway at the same time, both in our assessment and workup and diagnosis of the case. Do we need to do some investigations beforehand before we jump into moving teeth around? What's that going to look like? And does that mean that we need to start thinking about maybe some adjunct measures in terms of making enough space for the tongue? Do we need to think about working on the function? Is there any tongue restrictions there that we need to address? Do we need to work with some of our medical colleagues in terms of ear, nose, and throat assessments and treatment, particularly with regards to allergies, which we're seeing more and more of in Western societies, and some of the consequences that come out of that, like autoimmune conditions potentially. So these are all the questions that are running through my mind when someone comes to see me. I want my teeth straight. There's a lot of investigation that usually needs to happen in the background. We need to make sure that the masticatory system, the TMJs, the muscles, the teeth are all functioning well together and in harmony. And it's not just about making the teeth straight. We need to think about the space available for the tongue, but also making sure the lips, the cheeks, the jaw muscles, and the tongue are all functioning well as part of a balanced system.
No, that's a beautiful answer. I want to know in regards of what's different in Australia in that sense from United States. What challenges Australian dentists face different from the colleagues in Europe and US? Like, what do you think? Because I know you're very well educated and you see people from different, you run the association. So you see that what we should learn from Australian dentists, or maybe what Australian dentists should learn from us.
Look, I think going on this journey of, orofacial myology, dental sleep medicine, dentofacial orthopedics, and orthodontics, one thing that's been quite clear to me is that a lot of the teaching institutions, at least from a dental and medical point of view, are really quite behind in terms of other countries and how progressive they are. I think there's still a lot that needs to be done from an educational point of view. And taking that a step further, also a collaboration point of view, it's more and more encouraged, it seems, that people just go into their own little specialty and only worry or concern themselves with that isolated kind of field, and they're sort of oblivious or not understanding that maybe they should consider some further education in areas outside their discipline, so that they can bring everything together. So it's kind of like we need to be these super sort of generalists looking at all these different aspects, but it's kind of very against the the traditional medical model in Australia, where you might do your basic foundational degree or whatever, whether that's dentist or doctor, and then you would go in and specialize in whatever. But it kind of, that pathway kind of ignores all the other facets that we really should be bringing into the conversation in terms of our diagnosis and treatment planning. So I think that's one thing. And the other thing too, Australia, there's a lot of regulation as well, which sometimes is a bit of a barrier to not only education and collaboration, but also just how things are kind of done. And I think we're starting to see as well, some of the health insurers play a bit of a bigger role, which again seems to be more
So we were talking about how medicine is compartmentalized. So give me your view. What do you see when people who come to you maybe for straight teeth with a broken down teeth in the same time, you find what they have a sleep and breathing disorder, but on top of it, they have a bouquet of medical disease, and they are usually the same. At least for me, it's high blood pressure, atrial fibrillation, diabetes, anxiety and depression, allergy, and asthma. Tell me, what's your view on that?
So yeah, that's a really good question, Maria. So look, I guess my journey as part of being a accredited lifestyle medicine practitioner kind of gives a good framework to my response to that compartmentalization of the medical model. So you're right. You know, it's common for me to see someone come in with, you know, a concern with, you know, a chip on their tooth or wear on their teeth, and, you know, crowded or misaligned teeth. But when we review their medical history, they've got a plethora of, you know, specialists that they're seeing, medications that they're on. And, you know, there's a lot of factors that come into that. But, you know, going back to my lifestyle medicine training, really it comes down to a combination of problems with sleep, exercise, nutrition, mental well-being, social connections, and, you know, harmful substances like tobacco and alcohol, etc. And particularly sleep, and that's sort of, you know, where a lot of my training has focused. We know that if we're getting poor quantity, quality, and consistency of sleep, that can have direct effects and indirect effects on the autonomic nervous system, and that can affect, you know, how our heart functions. It can also affect hormone release, and in, you know, I guess what I'm referring to there specifically is we can see metabolic issues that, you know, might suggest insulin resistance or something like that. So there's a lot of, you know, connections between, you know, the oral environment and systemic and general health. And I think dental practitioners are really at the forefront of, you know, being the first people to pick up on these, but also offer some really practical advice and solutions to help in that regard.
I love that. I'm wondering, do people have the same negative approach towards dentists in Australia or just in United States? What I think we actually on the forefront, and we can really help, but we have that very negative image where, like a terrorist teeth whisperers, we have that needle and we have that bore, we don't control pain, you know, all of that kind of attached to us with media, which in real life, your office, I saw, it doesn't look like a torture chamber. My office looked like the art gallery.
Yeah, I think historically, you know, dentists have always had a bit of a bad rap. And I think, you know, that does relate to the fact that the way we're trained is we're trained as surgeons, we're trained as proceduralists, but what we're not trained as is physicians. And that should really be, you know, the foundation. It should be the medicine. It should be the physician part of it that should be, you know, first and foremost. And then, you know, the resolving symptoms and, you know, procedures should be only a minor component of our training and our practice. What we really should be focusing on is learning about these different, you know, systems and how they integrate with the head and neck and the mouth and oral function, particularly from a breathing, sleep perspective, but also a jaw growth and development perspective as well. And I think that's something that's, you know, really missing in a lot of the education. So we should be physicians first and then surgeons last.
I love your answer. You know, I have two educations. I have, you know, dental education in a medical school in Russia, and then NYU. And after Russia, when I came to NYU, I thought, oh my God, they really focus me on this area. But in Russia, you know, I did OBGYN training, dermatology training, internal medicine training, and I used to kind of bash it because, you know, as a young physician, you don't have a clear thinking system like that algorithm. But now, after practicing so many years, I now worship that education, that broad spectrum, how they taught me think, how they taught me to connect. And talking about general area, because this is, we do so many things with this area and very easy to test this area. And we can see by testing this area, we can see the future problems. So tell me, what's your opinion or what's your experience with microbiome testing? Because I use it a lot in my practice. So tell me how, what you get out of the microbiome and how do you see the benefits of microbiome testing in a dental office?
Yeah, that's a great question. And I think just from a academic or research perspective, we're starting to see more and more come out about the link between our microbiome and its diversity and a lot of different ailments, illnesses, and systemic conditions. And we know that the gastrointestinal tract, it starts in the mouth. So again, dental practitioners should be really at the forefront of all of this. And I've certainly used a number of different third parties and companies to do some microbiome testing from the mouth, taking plaque samples, looking at it under a microscope, analyzing it, looking for particular bacterial species which have been associated with various diseases such as Alzheimer's, cardiovascular disease, cerebrovascular disease, metabolic dysfunction. I could name so many, but essentially, using that data and presenting it in a live kind of form to our clients is really a good way, that we can achieve or, go through the motions of co-diagnosis. And it really puts the emphasis back on the client to say, look, there might be an issue here, or there is an issue here, and I'm here as your practitioner to support you. And, we want you to have the best outcomes that we can achieve. And I think if you, just sort of turn up for your 6 or 12 monthly, check and clean, you're kind of missing a really important opportunity to, look at taking some samples and then retesting to show that, that the intervention is actually working. And, that might differ a little bit from person to person, but I think there's really a big role for testing the microbes in our mouth.
But you actually, you send it to the lab. What test do you use?
So there is ones I've used that you can send to a laboratory, and there's also another one that I use where we actually analyze it live under the microscope. So you can do both depending on which company you might work with, but I think both have immense value, looking at the different complexes of bacteria and relating that to some of the known systemic conditions associated with those particular bacteria. And this might bring a conversation in about going to see a gastroenterologist or a clinical nutritionist, and that's a really important element of function as well. We talk about breathing and sleep, and that's obviously important, but we also need to think about nutrition.
100%.
Yeah.
Yeah, I have a lot of nutritionists and, that kind of functional medicine on my channel. So my last question to you, Alexander, tell me, during your training in Tasmania, did you meet Tasmanian devil and what he looked like?
Yes, I did meet a few Tasmanian devils, but unfortunately they suffer, a lot of them, from a facial tumor disease. So they're obviously a protected species. So we have to be very careful with how they're managed from a conservation point of view. If we want to keep seeing them around, they are very cute. But Tasmania is beautiful. It's cold and wet, but beautiful green, and a really, really, really nice place. But from a clinical point of view, it's actually the highest unemployment state in Australia. So really quite a lot of low socioeconomic status. And that kind of goes directly to my training as a lifestyle medicine practitioner, where we look at the social determinants of health. And certainly a lot of those social determinants for a lot of people in rural and regional areas in Australia and around the world, access to care is something that is really difficult, and also Also we find that you know, those sort of situations are associated with poorer sleep and, you know, poorer nutrition. So there's a lot of factors there that, you know, as an individual practitioner are sometimes hard to address, and really we need to think about, you know, more of a governmental kind of approach, a broader approach, if we want to see any change in the long term.
Thank you very much, Alexander. I really enjoy our time together, and my listeners can find the information, and I'm going to put the QR code underneath your interview. And if we have listeners, our listeners in Australia can actually experience your comprehensive care, and we can just learn from each other. And I'm looking forward for our collaborative projects. You know, speaking engagements, and maybe going to Tasmania to see the devil together.
Thank you so much, Maria. I really enjoyed our chat, and yeah, it's been an honor and a privilege, and yeah, keep doing the great work that you're doing as well.